Hello, thank you for joining us today. This is James Kanka, Marketing Director Relations. I'm going to give a few more minutes for all attendees to join. We have 31 on now, but we're going to wait until we get a few more. So thank you for tuning in. I'll be right back. Hello, thanks for joining us today. My name is James Kanka. I'm the Marketing Director here at Relations. Today's webinar is going to be quick digital health campaigns that bring value to patients and practices. One of the reasons that we did this is because our customers have been doing some really interesting things with digital campaigns that drive more appointments, they close gaps in care, and they help to keep them top of mind with their patients. Unfortunately, what we've experienced is a common reaction that it's really daunting to get these set up. And Ann, our expert who will be on here during the second half, has shown us and our customers that it doesn't really have to be that hard. And the payoff is pretty big. So make sure you stay tuned as she walks us through building an annual appointment campaign later on. And a little bit of housekeeping before we begin. We will be recording this webinar and we'll be handing that out next week to you along with the step-by-step guides that are going to be mentioned during this webinar that Ann has created. And these are agnostic to the EHR, PM, or even the communication platform. And additionally, we're going to have some Q&A time at the end of this. So please stick around. You can submit questions anytime via the GoToWebinar chat panel. And we'll be sure to answer those if we have the opportunity. If not, we'll reach out to you afterwards via email. All right. The first thing is I was a little bit interested to see how many of you are currently running digital campaigns. I'm going to launch a poll, and if you have in the next 10 seconds, just let me know which modalities you're using or if you're using any at all. Do you send text messages, emails, or voice for digital patient campaigns? And I'll get back to you all towards the end and let you know what people are up to. All right, let me introduce to you as you do this, my favorite person, one of my favorite people here in the office, and I'll let him introduce himself, but this is Trevor Brown, and he's going to walk us through the first part, give us some context to this.
Thank you, James, for that introduction. Hello, everybody. Thanks for taking time out of your busy day to join us today. My name is Trevor Brown. I'm the Vice President of Business Development here at Relations. I'm going to spend just a few minutes here in the first half kind of walking through the why before Ann takes you through the how. Both why digital health campaigns, but also why digital. We know a lot of groups that I talk with today are already doing some kind of outreach, but it may look more like a manual call. Sometimes it's postcards or mailers. So I want to talk about why digital. And there's some reasons on the screen. There's some of the obvious ones. It's more cost efficient. It's more effective. You have more time to get this done. And I think the timeliness is the one that we seem to overlook, right? We can have an automated data trigger, send this out immediately and have a patient receive it rather than waiting for the entire process of snail mail. And we can also find out how well that did. So it's trackable. And we can test these different outreaches and then adjust them as we go. Some quick examples. I mean, this has been going on for some time. There's a lot of good studies out there. This particular one was a group who was doing texting for pre-colonoscopy screenings, looking for ways in their intervention results to try to improve from the inadequate prep quality. And in a very short amount of time, I would say, in just 3 months, so 1 quarter, they were able to reduce that from 11.5% to 3.8, almost a quarter of what it was before. Now, inadvertently, I believe, through this entire process, they were also able to drop the no-show rate, which is always a plus and an improvement. We all know one of the things that we fight with day in and day out is getting the patients to the right place at the right time for the right reason. Anytime we can do that, it only benefits everything else that we're trying to do in terms of revenue generation, closing gaps in care, and better outcomes. Continuing down the thread, some of you may be very familiar with vaccine compliance and the issues that presents. The first is just a meta-analysis of several different studies that saw that digital outreach was able to improve with some kind of reminder the overall adherence by 8%. Now, even more interesting, the follow-up study looking specifically at SMS text reminders for influenza vaccines was able to increase the likelihood of them getting that vaccine done by 39%, a tremendous improvement just by implementing SMS text. And so when we look at this, we take this and try to apply it and these ideals to how we're engaging and reaching out to patients. And it sets in mind of what has worked in the past and what hasn't. So one of the things that we have seen in doing this is healthcare has built some great tools, some things that are very highly advanced from a technology perspective. However, we built them in silos and said, hey, patients, here they are, come to them, and we don't have good adoption. Now, it's not a deficiency necessarily on the technology side, but it's a deficiency in understanding how to engage patients and what works the best for them. So whenever we took a step back, we wanted to study some different human behavior studies out there. If you've done any webinars with us in the past, you've heard this before. One of the ones that we lean on the most is the BJ Fogg behavior methodology. So if you haven't heard of Fogg before, you can go online, look up one of his TED Talks, and he says in order for behavior to happen, you got to have 3 things present. You have to have trigger, motivation, and ability. And so real quick, I'm going to walk you through about a 30-second sample that will make us all human behavior experts on the phone. So having a relevant trigger. Let's pretend that everybody on the phone, your cell phone rings, and you don't answer it because. Now think of a reason. If that reason was, I didn't hear it, I was in the shower and couldn't get to it, I left it in my office and I was in a meeting, that's ability, right? You had a trigger, but you didn't have the ability to answer that phone. Now, if the reason that you said was, I didn't want to talk to that person, it was that relationship rep calling to sell me something again, and I just didn't want to talk to him, that's motivation. Congratulations, you're all human behavior experts. So without any one of those 3 present, then we lose the ability to have a behavior. And so in the historical realm of healthcare, what we've seen with the apps and the portals, patients don't adopt them. They don't want to create an account, sign up for a username and password. Now, this could be for several different reasons. Maybe they don't want to. Maybe they don't understand the technology. Maybe they want to download that app, but they don't have room on their phone, right? There's tremendous amounts of different reasons. So instead, we need to look at what is the technology they're already using today, how do they have expectations from the other industries they interact with, and wrap the experience around those day-to-day activities. And so what this looks like is more of a patient-centered approach. Right? We're using very simple, relevant, quick and easy to answer call to action triggers. Patients don't have to leverage passwords, usernames, accounts, or portals, and we have a very broad reach. So whenever we say that, we want to look at ways to reach 90+% of the patient population. This typically looks like a text-leading approach with phone and email backup. And from there, we can take it and apply it to this patient journey or patient communication that we have today. And so what it looks like for us is a roadmap for the patient of how to stay engaged with the clinic and you giving them simple and easy directions. In one way, shape, or form, it's kind of like GPS, right, and navigation. Everybody knows whenever you start a trip where you're trying to go, but you still need a little help with how to get there. A right turn here, a left turn here, take the next exit. And we want to help you do that same thing for the patient, making sure that we can guide them and direct them as things change to get to where they need to go. So when we first started doing this, one of the first ways that we applied it was simple appointment reminders. Chances are most of you on the phone are already using us for appointment reminders today, and you're familiar with our multimodality approach, best practices for appointment reminders. So driving those no-show rates to the lowest possible standard. So with that, we'll start with an email 4 days out. We try a voice call 3 days out. Text messaging 2 days out. And then a close proximity text message. We do all this because we know that multimodality approach is the one that is going to elicit the greatest final results. From appointment reminders, we wanted to expand and start to add that into all the other ways that we can touch on the success of a clinic. What you see on the screen is what we would call the ABCs of success. We're looking for ways to improve administrative, billing, and clinical outcomes. We always start with the administrative there because, first and foremost with the appointment reminders that most of you are using today, we got to get the patient to the right place at the right time and for the right reason. If we don't, none of the other stuff matters. From there, we moved on to help patients self-service some of these other things and tasks that they have to do, automating some of this directly from their smart device, making it easy for them to pay a bill, even post-adjudication once they've left the office. And now once that has happened, what can happen a lot of times is patients can be out of sight. We want to make sure even though they're out of sight, they don't end up out of mind. And that's why we have loaded all the things that we've just talked about and the ideals in a patient-centered approach into what we would call health campaigns. So these are automated campaigns targeted at and focused on closing gaps in care, sending educational information, and keeping patients in the loop in front of mind. Now, it doesn't just help do that. It also helps create a relationship with the patient for the clinic. I do want to let everybody know that flu season is coming up and they should get their shot at the appropriate time during the year because it's good for them to get the flu shot. But also, I want to make sure that I'm the first to remind them and I let them know, hey, I'm your primary care provider. I am your whatever that may be. Come get your flu shot from us because we want to take great care of you. Don't go to the Minute Clinic or the walk-in clinic down the road. We want you to come see us to get that good care and to make sure that you are first and forefront of their mind anytime something happens. Now, of course, whenever we start to create these health campaigns, the last thing you want is somebody like me creating those. You want somebody with a little bit more experience and knowledge from a clinical background. And that's why we reached out, sought far, high, and wide until we found Ann. Ann Baker joined us just a few months ago, has a tremendous background for clinical experience and knowledge. She's a registered nurse. She's been in the healthcare industry for more than 20 years. She's a certified professional in healthcare quality and a former quality director of a very large multi-specialty practice, and has done a tremendous job building out step-by-step tutorials for our health campaigns, consulting with the clinics who are using our products to help them find the best way to leverage them to help close gaps in care and drive clinical outcomes. And I'm very excited to have Ann present to you today how you can build campaigns with our tools, the simple ways to set them up, and some of the ways that they can help drive measurable outcomes for you and your clinics and your patients. With that, Ann, take it away.
Well, I just don't think I was worthy of quite that glowing of a introduction, Trevor. Thank you very much. Good afternoon, everyone. Just a quick overview of what I'll be talking about today. I'll be discussing kind of really what is a health maintenance campaign. We're going to take a look back at how a health maintenance campaign was done in the past and the challenges it presents to our practices. I'm going to talk in detail about Relations Health Campaign Manager product and how it can take the patient burden out of the practice's hands. We're going to actually walk you through an example of how to build a campaign. And I'm going to show you some of the added bonuses of using Relations Health Campaign Manager. So what is a campaign, a maintenance campaign? It starts with provider practice, identifying a patient need, and then trying to contact them to fill that need. And the need is generally a gap in care. And a gap in care can either be preventative in nature, such as a woman who is overdue for her routine mammogram, or perhaps it's a health condition or event like a diabetic that's not had his hemoglobin A1C in the last 6 months. It can also be used to send educational information. An example may be that a practice may want to send an information sheet about signing up for their portal to the patients that have not enrolled yet. that can also assist with test result notification, and some of our customers have used health maintenance for some other creative reasons as well. Next slide, please. Back in the good old days of paper charts, it's important to take a look back and remember how health maintenance was accomplished in the days of paper charts. Many years ago, I worked as a nurse for a large OBGYN group, and of course, back then we had paper charts. For patients that needed future appointments for follow-up, we kept track of these in a 3-ring binder separated by month and year, and as patients needed, for example, a pap smear in 3 months, a repap in 3 months, we wrote the patient's name, MR number, date of birth, and phone number, and what they were due for, and the month and the year it was due. So as that month came due, the nurse had to go pull the chart, check to see if they came in. They didn't come in for their appointment, so the nurse had to make a call, send a letter, whatever it may be, reminding us they were past due for their repap. And holy cow, guys, high cost. This was typical for most physician groups. And oh, by the way, there was no way to track when patients were due for their preventative appointments or testing. These patients were just on their own to remember. Health maintenance back in the day, paper charts was time-consuming, it was expensive, it was inefficient, and it was very incomplete. And next slide, please. So then came the electronic medical record, our wonderful tool that we have now. So in most cases, the EHR can query medical records looking for patients with gaps in care and create work lists of sorts. Someone who understands reporting functionality of the EHR can now write a report to show, for example, all patients between 50 and 75 years old that don't have a CPT code for colonoscopy in the past 10 years. That's going to give you your work list. So they'll run the report, print out the list of patients, and an employee then can make phone calls, send letters, messages through the portal now, and they're going to try to attempt to reach that patient, get them in the office. So we've got to step in the right direction for sure. Another improvement that the EHR gave us were recalls, and most systems have recalls built in. And the way they work is patients in the office for an appointment, provider recognizes they need to come in for a follow-up appointment or a future test. So they create a recall at the point of care in the EHR. And so that recall is set to provide a work list, again, of patients that needed contact for their appointment maybe a month or two before they're due, and someone still needs to work that list to contact the patient and make those appointments. So we made a lot of improvements with the EHR. We've got real data containing patients with gaps in care, future testing needs, and we're definitely keeping track of the patients with preventative needs. But the EHR has not solved the problem of the enormous time commitment, the expense, and the inefficiency of patient outreach component of health maintenance. But the good news is that Relation has. So next slide, please. So what if we could take that work list of that your EHR created and do all the outreach for you? So just take a moment and think of all the resources that frees up for your organization. With Relations Health Campaign Manager, we're going to automate your patient outreach according to your customized specifications by phone, text, and by email, as Trevor explained earlier. Next slide. And so this is really how it works. You're still creating your EHR report. We need you to gather that data for us. So you're creating a report, and that may be through a clinical alert or just a report that your system will run through the practice management program or something similar. And then we're going to create a campaign in Relation. So Relation then the campaign in Relation will decide how you're going to communicate with your patient, what message you want to give, how often you want to outreach to them. We're going to have to make a connection between the report and the campaign, so we'll do that in the background. And then we link the campaign to the portal, the report to the portal. And then once everything's enabled, we're going to start sending those messages out to your patients. And as your file, the report we're receiving from you, updates, we're going to update the messaging on our end. So patients that made appointments will no longer receive messages. Patients that fall out of the campaign, if we've messaged them to the maximum amount you'd like us to message them, they'll fall out of the campaign. And then we can repeat the series of messages as you desire. So if we're sending a text and then following by an email and then followed by a voice call, we can repeat that for next month. And then if you want to do it one more time or whatever, it's whatever the customer wants, we'll customize those campaigns to match. So really the only time required by the practice is to create that list of patients that we need to contact and help us create the campaign. And from that point, it may be a matter of, it could be just set it and forget it and you're done with it. Or we'll do all, your system will send us all the messaging, all the patients that we need to message, and we'll take it from there. It may be a fact that you may have to run a report and upload it or send it through an SFTP to our system, and then we'll run the messages from there. But even that is so minuscule compared to the amount of time that I'm sure staff is using currently to contact their patients and get them in for their outreach. Next slide, please. So this is how we would make the report. This is just an example of how we would make a report to gather the patients in your system. And I'm using Greenway as an example. This can be similar to what you're using in your EHR. Greenway uses clinical alerts to be able to find the patients with gaps in care. And the example I'm using here is not seen in greater than 12 months. So someone that hasn't been in your exam in greater than 12 months. So the first thing you need to do is think about the pool of patients that you want to gather from. And in this example, you may not want to look at all patients in your system. So you may want to limit that pool to maybe patients that have had visits within the last 3 years. You may want to add a diagnosis code on that. You may not need to, but if it makes sense to you to add a diagnosis code, so patients that haven't been seen in the last 3 years with a diagnosis code of annual wellness visit, or it could be a CPT code there as well. So you want to get that big pool, and who do I not want to contact within that big pool? What I want to not contact are patients that have been seen. So we want to filter those patients out. You may want to filter out patients that have an upcoming appointment. Now, Relation can also filter those out, that if you aren't using a Relation product, you may want to filter out patients that have an upcoming appointment. And then you want to think about, who do I not really want to contact? Of course, a deceased flag or notification if you have that in your system. Maybe someone that's in collections, or if they've been removed from your practice, you want to enter those flags. In Greenway, you want to assign a clinical alert flag, and that's what we would connect to there. That may not be necessary in other systems. So from there, I'm going to switch over to our Relation portal, and we're going to go ahead and I'm going to show you how to build a campaign in the Relation portal. And hopefully you're seeing my screen here. Let's see. James, can you verify that you can see my screen?
Yes, and we can see it. Thank you.
Oh, perfect. Okay, I just couldn't tell on my end. All right, so within the Relation portal, this is how you're going to customize how we're going to communicate with your patients. And I'm going to go through some of these steps. This is actually, the customer can build these on their own, and we can also build them with you and help you walk through the building of a campaign. So one of the cool things that I love about our campaigns is we can set priorities. So if you have a campaign that is basically, just what we just built, an annual exam reminder for an annual exam, that may not be as high of a priority of a campaign than maybe a patient who has melanoma that's not had their follow-up visit. So in order to prevent us from violating any TCPA rules, we want to make sure the most important messages go out before the least important messages. So if a patient belongs to multiple campaigns, they've got multiple outreaches that they need, the most important ones are going to go out first. So we're able to actually customize priorities of our campaigns just to make sure the most important ones go out first. Transfer number. Our voice calls can can direct a patient to press 8 to transfer into your system, your phones, to make that appointment, and we find that very effective. So we want to make sure we list a transfer number in there. Forgive that this says diabetic A1C overdue. That's not supposed to be there, but I couldn't get it to move. And then we talked about how Relations can prevent messages going out for patients that have appointments scheduled. So this is customizable as well. We can, whatever makes sense with your practice and what makes sense for this campaign, we can customize that to prevent any messages going out to patients that already have appointments scheduled. And then we can prevent messages from patients that just had appointments. Again, customizable to whatever your needs are for this campaign or for your practice. But the reason we would do this is if they just had an appointment, maybe the documentation hasn't followed through, maybe they haven't fallen out of the campaign yet. We don't want to just send a message to someone that just already had that appointment type. So we will hold those messages until this time frame has passed. If they're still in the campaign, we'll send the message at that time. Contact days. You get to decide what days the messages go out. If your practice has a very busy Monday on phones, which I know the practice I came from, it was crazy. So you may not want your health campaign messages to go out on Mondays. If Monday afternoons are lighter than Monday mornings, we could still do Mondays, but then we could just isolate the call to Monday afternoons, and we can do that with any of the days here. If your office is closed on Fridays, we wouldn't necessarily want messages to go out on Fridays. You can limit the amount of messages that go out in a day so that you don't bombard your scheduling staff. And then also you can add if this is a revenue generating visit, I would definitely encourage you to add a value in there, because I'm going to show you a report that's going to be very powerful in showing the return on investment for this product. And then our messages are available in English and in Spanish. So if the preferred language in your system is Espanol, the message will go out to them in Spanish. So you can do it either way, one or the other, or both. And then we talked about staggering the voice message and the text and the email. And for health campaigns, because we have the ability to transfer them in to make that appointment right away, we like to send the voice message out first. And then let's say we want to send, if they don't make an appointment, maybe 3 days later, we want to send that text message as another reminder. And if they still don't answer that, make their appointment 7 days maybe from that voice call, we'll send that email out. And then the series can repeat. If after 7 days they still haven't made their appointment, we can repeat this cycle. And this is customizable. Again, right now it's set to repeat once every month for a maximum try of 3 months. And probably at that point, it's probably a given that patient's not going to make their appointment. So you'll definitely want to put a limit on this so that you don't send an overabundance of messages to your patients and annoy them. So there's a line that will help you guide you through to make sure you're sending enough but not too much. And same with the text message and the email. And then I'm going to switch back to the presentation. If you wouldn't mind, James, send me back to the presentation, and I'll go back to the additional slides. So this report here is available in the Relations portal, and this is a great report. This is a contact report. This is going to show per time frame that you select. It's going to show every patient that was contacted for that particular campaign. It's not only going to show what day and time they were contacted. It's going to show whether the text was received, whether they transferred in to make an appointment, whether they hung up on us, if it went to answering machine. And the beauty of this report is these MR numbers over here, they're actually hyperlinks. So they will, if you click on them, you can actually listen to the voice message. You can listen to them pick up and answer the phone. You can see what message was sent. This is a great report. If you find yourself in a legal situation where someone said, you never advised me of that I had future appointments and now I've got full-blown cancer, you have these will stay housed in Relations indefinitely. So you can always go back and search for that patient and find out all the communications that you have sent to them. So it's a great legal tool. Also, if you are patient-centered medical home or planning to be, or specialty practice, not only is patient outreach a requirement, but you also have to prove outreach. So printing a page or two of this off and hiding your PHI, which I did here. This is an actual report from a customer, so I hid the name and the phone numbers here. But this is a great documentation tool that you can submit for certification. Next slide, please. We talked about the ROI, adding the estimated revenue when you build your campaign. And Relation will send on a weekly basis a report. It's an estimated revenue generated report. And this is an actual report from one of our customers. This is, again, this is from an OBGYN office. This is an annual GYN exam campaign. What this report reflects is patients that fell out of the campaign the week prior that have an appointment scheduled within the next 60 days. So we attempted to contact them. They made an appointment, so they fell out of the campaign. And this particular campaign for this customer, 37 patients fell out of the campaign that week that made an appointment, and had all of these patients kept their appointment, which you're going to assume many of them would have generated or did generate an estimated revenue of $2,775 for this practice. And that was within 1 week's time for one campaign. So if you are in a position where you need to justify the ROI for this product, this is an excellent tool for you to present to your providers or your administrators. Next slide, please. And, we want to make sure that we help you stay compliant. It's really tempting in an email or a voice message to share PHI. The more information you give them, the more likely they are to come in and get their appointment. But you don't want to be on the HIPAA naughty list. So you definitely want to err on less is best with campaigns. And we will help guide you on that as well. If you feel like you need to the patient needs to know more specific information for scheduling that appointment, we have a coding system that we can help you through, or you can say, dear Mr. Jones, it's time for your follow-up appointment. Please mention code F12 to the scheduler when you make your appointment. And so your scheduler will know that F12 means melanoma follow-up. So you can get around it that way. And that coding system tends to pique the interest of the customer, the patient. And we find that helps them to be a little bit more compliant. So that's kind of cool. And our product is going to help you stay TCPA compliant, so we don't over message. And we talked about that with oh goodness, what is the word I'm thinking of? The priority of the campaign. And let's see here. So wrapping up here, just to recap, we want to help you keep your patient population engaged in their own health. Patients forget, they don't know what they're due for. So our health campaign manager will help allow your patients to be out of sight but never out of mind, as Trevor mentioned earlier. And your patients can have the confidence that you will let them know when they're due for tests or appointments. In order to help you jumpstart your campaign adventure, we will be providing you with our pre-built campaigns. And I'm going to show you an example of that here in the next screen, please. This particular one is Greenway specific, but the campaigns we also have available in vendor agnostic. So any of the EHRs will be able to use it. And they're just basically guides, ideas. You may want to change coding, you may want to change verbiage, but this gets a jump start on how to run campaigns. And they're available in many different specialties, or several different specialties. So next slide, please. For our primary care campaigns, we have hemoglobin A1C, diabetic foot exam, HPV vaccine, hepatitis C screening, pneumonia vaccine, shingles, cholesterol screening, diabetes, and plus all of our GYN and pediatric campaigns. And next slide, please. You can see here, I don't need to read all these, but we do have a fair amount of OBGYN health-related campaigns. And next slide. And pediatrics is a big one. We have quite a few of our pediatric campaigns. And next slide. So before we jump into the question and answer session, I just have a few questions for you guys to think about. And they are you currently following up on gaps in care? If you're not, you should be. Who's doing your outreach and how are they doing it? Are they sending calls, letters? How much are you spending on your outreach? How could you utilize staff if they weren't doing outreach? Could you downsize? Could you avoid future hiring? Could you use them in a more productive manner? Are you applying for PCMH or PCSPH? And it's a requirement to do outreach, and you need to show documentation of attempts. This is a perfect tool for you. Are you doing any quality reporting, NIPS, or are you part of any programs that you need to do quality reporting on? Automated outreach are going to help you close gaps in care. It's going to increase your compliance. This equals better quality scores, better reimbursement, possibly better insurance contracting. And lastly, are you interested in increasing your business? As you saw earlier on that ROI report, increased revenue can be significant from health maintenance campaigns. It's a wonderful bonus. And that's all I have today. I'm going to turn that over to James to start the Q&A.
Thank you, Ann. That was great. Hopefully you all found that really helpful. We'll send this out again in all those step-by-step guides. If you have questions, you can always reach out to us. But here, let me answer some questions. If you have an opportunity or you have a question, you can submit it via the GoToWebinar control panel, and I'll do the best to raise those. And whoever is best to answer, either Trevor or Ann will take it. First, let me share some of the results that I got from the poll early on. Let's see if I can do that here so you can see it. It looks like 52% of you do some type of digital campaign, which is great. A lot of those are email, and then second would be text and voice. So great job for everybody that's doing something already. So that actually leads me to my first question that I had thought about is how many of these, and I don't know which one would be best to answer, but how many campaigns could somebody run at a time? Or is there a diminishing returns at some point? I don't know, Ann, is that for you or?
Yeah.
Okay.
Yeah. I'll take that question. No limit to how many campaigns that you can run at any one time. So, your goal is to close those gaps in care and provide the best care that you can for your patients. So, if they have a gap in care, you need to be doing outreach on them. You need to be taking care of them. We have customers that are running upwards of 30 campaigns at one time. So it's definitely no limit to it. The more the merrier, honestly. Your patients appreciate them.
Great. Here's a question coming in. Can we connect this with the Epic system, Trevor?
That's a great question. We didn't talk kind of much about the integration specifically. The way that the platform works is all the campaigning is done out of our side with the logic. We kind of sit on top of the report writers within the EHR system, so to speak. So as long as we have a way to get access to the data. Now, that could be something where if there's an API for us to go in and pull for it, we can. We have several groups that will just automate files. They'll build the reports within their system with the inclusion-exclusion criteria, and then have those files set to be automated and kicked out to us, and we can SFTP those over. So there's a lot of different ways we can get data. We do have Epic clients using this. Generally, as long as there's some way for a file to get to us, and most of those can be automated with the systems that are out there today, it's very easy for us to implement, this solution. Ann, is there anything you'd add in kind of general?
No, you covered it perfectly. Thank you.
Awesome.
I got another question here from Leslie. What data do you have to support the contact series, voice, text, email, et cetera? What kind of data do you have to have in the system
So, like, what do we need? Is that what you think's being asked? The data that we need typically just comes from the appointment reminder data that we're already getting. So as long as you have good data for the patient within the PM, that's what we're going to be using that comes over in the file connections we already have to reach out to those patients. Now, in terms of when do they get each of those, that's set up typically with Ann and her team on the front end to build out the campaign and talk about, do we want the first touch to be, as you saw earlier, voice, text, email, etc. But we do need that information pre-existing within the PM system before we can do it. You know, the data has to be there for us to put it into action. Hopefully that answers the question.
All right, here's a question from Christine. Is Campaigns an add-on product?
Yes. Yeah, Campaigns is an add-on product, and the reason it doesn't usually sit as a standalone is because of the last question that we had. We already need that data that comes over within the appointment reminders in order to coordinate those messages and campaigns going out. Another reason, there's logic in there that I believe we covered earlier, so that if a patient already has an appointment on the books in the near future, maybe 30, 60, 90 days out, we're not going to message them to keep from confusing them, but also they may be coming in to get that care gap closed. So it's typically an add-on for appointment reminders.
I've got one for another EHR system.
Great question on Emma Modernizing Medicine. We're working on getting on a roadmap for having that as an integrated solution. Today, I just spoke with Aaron Treifler over there earlier this week. There's no current way yet to automate those reports out. There is a manual process that some clients have done to date. I'm not a fan of that. I hate anything that creates a manual process for the clinic, but they've used the Advanced Clinicals Targeting feature, gone in and done manual reports, and then pushed those over to us and uploaded that file. Once we have that file, again, all the rest of the logic is built on our side, and we ran it out that way.
Here's a question. This is a new one to me. Do you see facilities using this product for outpatient testing reminders? I'm not sure.
Yeah, I'm not positive how that would work, but I'm sure that's something that we could look at, definitely. As long as we're receiving that appointment data, again, if it's something that we're already sending appointments for, we can certainly find a way to do outreach to it.
So I'm trying to think in my mind of a good use case for that. If whoever asked that question wants to try to throw a use case out, something that I may think of is perhaps a sleep lab. The patient needs to come back in and get titrated on a regular, maybe semi-annual basis for that CPAP or that BiPAP, whatever it is they've been put on. Maybe you go through and look, and that hasn't been done. We can, again, if you can run a report with inclusion-exclusion criteria to identify patients, we can put that information into action.
Right.
And earlier you answered a question, and Leslie was following up. Why do you recommend that order? And I think it's with the type of campaigns that you can do and how many.
Can you repeat the question? I'm sorry.
She was just following up on a question, and I don't know the context of it. I was hoping that maybe you could help me. She was asking, Ann, why do you recommend that order?
I wonder if it was the messaging order.
Yes, I think let's go with that.
Right, and typically because of for the outreach for campaigns, we like to send the voice message first because of that option to go right to scheduling. We find that we get a little bit more compliance with that. As far as following up with text or email, I think that's one way or the other. Don't think there's a big difference between that. It would be more of a provider preference or practice preference. That's the answer.
Yes, so she said that is what she was asking. So great job. Thank you, Leslie.
Okay, good.
All right. Irving has one here. I think it's a follow-up to the Epic about, can you read it? It asks, would there be an issue if we use the Epic system from Children's Hospital through Citrix receiver API-wise?
That's a great question. And I'll be honest, I don't think me or Ann should give you an answer. We have some people that are easily smarter than me. Believe it or not, they're even smarter than Ann, and they work on the technical side. And so if you want to send us a note directly, what I'll do is get our IT team involved and have them talk with your IT team specifically and make sure there's no challenges there. But there could be just a few idiosyncrasies whenever we get into systems like that, and we'd just like to make sure that it actually would work the way that I think it would before we give you a solid answer.
Here's a good question to follow up. We are currently using Greenway as a PM system, not for EHR. And does this affect us to use the services of campaigns?
So great question. We'll still get the appointment reminder data over from Greenway. If you want to follow up on that question and let us know which EHR you're using, I can let you know what the integration would look like for that. The health campaigns is one of the few solutions we have that really needs to dive into the data within the EHR. But again, as long as you have a way with whichever EMR you are using to generate a report, especially in an automated fashion, then we can plug up to that and make it work.
All right, here's a good question from Jennifer. Do you have secure texting and secure email?
Great question. As it sits right now today, no. Ask me that question again in about 45 to 60 days. That is one of the things that is on our roadmap being developed, as well as some other things like patient self-scheduling that's being launched this quarter and our updated version of check-in that's finally set to be released. So secure messaging is on the roadmap for this quarter as well.
All right. Can these be used to drive patients to portals?
Absolutely. We run into that all the time. One of the things that I talked about earlier about we come in and we try to layer in is that gaps because the portals haven't worked in a general sense. I don't want people to hear me say that portals don't work. They do, and they work especially, obviously, only for those patients who adopt them, but for those patients who do adopt them, they're a critical and crucial tool. So we don't want to come in and compete with those or drive people out of them. We want to layer on top as an adjunct and coordinate with them so that we can fill in the gap for the rest of the patients who have not signed up for or adopted that portal. And one of the ways that we can help do that is by sending these messages in this patient-centered way to engage a patient. Now, once we've engaged them, you tell us what you want to drive them towards. What's the action or outcome? It could be schedule an appointment to close a gap in care. It could be sign up for the portal. We'll drop whatever links you want in these messages to drive some kind of outcome for the patient. And that's a very valid campaign that we've done for others in the past.
Let's see. If you have any questions, send them to us. I will ask another one here. Let's see. Our population is largely Medicaid and Medicare. Would you think it would work with this population?
I do. These populations obviously present some specific and unique challenges. Anne, were you going to hop in there?
No, I was actually going to say pretty much the same thing. Probably voicemail or voice messages will be your better opportunity of outreach to them. But certainly, absolutely, it would be a great opportunity to outreach to your Medicare and Medicaid as well would be texting and email. But 100% yes on that one.
We work with some FQHCs and safety net hospitals and medical centers. Some of the challenges they run into when you're looking at demographic challenges, some of their groups may have phones that are government phones. Some of those phones only have service for so many days at the first of each month. So what we'll do is coordinate messages to go out at specific intervals within each month. So we want to try to get in touch with them before those minutes run out or the data runs out earlier in the month, typically within the first 14 to 15 days. That same group has done some very interesting campaigns around driving information that's just relevant, maybe not necessarily from the clinic, but to the patient for what's relevant in their area. So some of these lower income areas, if you're serving any of those, it may be that they are in somewhat of a food desert or they have to make decisions sometimes about, do I want to buy food, groceries, or do I want to buy my medication? Where there's services in some of these certain localities, such as food trucks and other things of that nature. So messaging to let them know, hey, there'll be a food truck in your area next Tuesday, and coordinate with local services so that they can take advantage of those and still have money left to buy their drugs at the same time. So there's some ways that groups we're working with have been very creative and very kind of front leading edge for how they're thinking about how to use our tools to attack and engage issues that they see within their population.
That kind of leads into another question I had for Anne. Anne, what is a unique campaign that you've seen a customer using?
I think the one that sticks out in my mind more than any of the others is we have a pediatric group that is running a reproductive health and pregnancy campaign. And what this is it's an email message that goes out to the parent or whoever. I'm sure it's the parent that is on the email list, and it's they are advertising basically or letting them know that they offer an appointment type targeted at the young age, the teenage. It talks about pregnancy prevention and reproductive health. So I thought that was probably one of the most interesting ones that I've seen. They just send it out twice. They send 2 messages out. It's the same message, and they send it once every 4 months for two tries. So I thought that was kind of an interesting one, interesting use of a health maintenance campaign.
Nice. All right, Yolanda has a question. Do you have the option to integrate relation with another EMR, or really what EMR EHRs do we connect with and how?
Yeah, that's a great question. So today, the good news or bad news, depending on who you talk to within our organization, is that we integrate with 87 different EHR and PM systems. Sales loves that. Our IT team and support team does not always love it as much. Whenever you make a new release, you have to release something essentially 87 times. But they found a very good way to make that scalable and put it into play. But it means that we can service a large majority of the providers in the country. In terms of how our integrations work, there's no specific way that we say we have to integrate that way. We'll leverage APIs where available. We can do HL7, flat file, or if direct-to-database is an option, we will do that as well. We're always looking for other newer technologies, such as RPA and bot technology, where applicable, to try to find ways to help get data out of your system and put it to action as well.
Sequoia has a great question. How can you utilize this within an independent physician association that already has workers who complete outreach but want to increase the daily productivity?
That's a great question. I think one of the things that we do on a day-to-day basis is finding the most efficient way to load balance human touches with automated effort. So for one, they're sending out all of this outbound outreach when in reality, you're looking for the ones who are going to reply and need some type of action done. The way that I would see is loading what they're doing up into our campaigns, into the Health Campaign Messenger, having it send out to then drive call volume back in. And so now your humans that are doing actual human effort can spend their time fielding calls that are relevant and that actually need some type of human interaction rather than doing the outbound to find the needle in a haystack. Let us sift through all the other patients out there and put your humans to work. It feels weird whenever I say it like that, but put your humans to work doing things that they need to do, right? So we can do the simple, mundane, repetitive tasks in an automated fashion with technology, and then they can spend time in compassionate care with the patients.
This one is a little bit different, but it's a follow-up from Irving. Does the patient balance messaging, I think we highlighted earlier in the patient journey, does it integrate with our current payment system? And he said they use Navicure.
I don't know that we have actually attempted to hook up patient balance messaging with Navicure, but I would love to give that a shot. Interesting enough, our new SVP of sales, my new boss, Robbie Att, came from Navicure just earlier this year, and he was there for 14 years. And he is not in on this webinar, but he has plenty of contacts over there that I think that's something that we could easily make happen.
All right, let's see. If you have more questions, we'll be here, but I appreciate everyone for joining us. This has been a great time. I really enjoy all these questions that you've offered. Let's see if I have anything that I just pulled up on my own. I think this is answered, but just to reiterate, what modalities is it, and is it a one-time, or can you create a sequence out of it? I remember you answering that, Ann, but can you
right. Yeah, no, I can reiterate that. Voice, text, and email are 3 modalities. You can use 1, 2, or all 3. And the benefit of our system is that it can stagger those and repeat that series. So it really will help increase the patient compliance by touching them at different points, and just more of a tickler reminder that we're still thinking about you, and we still like to see you make that appointment for your health. So yeah, it's a great question and worth repeating.
Here's another one. If somebody here doesn't have the specialty that's listed and they want to create an idea for their own campaign, can they do that, or can they reach out to us for help, or even do they set these campaigns up themselves, or if they use Relation, do we help them?
Both, all of the above. We have a lot of customers that do from start to finish. They are savvy. They know how to run their reports in their EHR. They're comfortable building the campaigns and Relations, and pretty much start to finish they can manage it. Once we've established that initial connection, And others take more hand-holding, and we're happy to do that where it's needed. So, the sky's the limit with it, and whatever interventions you guys need us to help with, we're happy to do it.
All right. That's it. If you have any further questions, it's up there. You can reach out to me at James or jkanka@relation.net. I sent out the invitation. You can reply to that. We'll do our best to answer you those questions and get you the recording of this webinar next week, along with those step-by-step guides. Reach out if you have any questions. Thank you for joining us. Have a good day.
Thank you, everybody.